Good evening and welcome to BBC London. I'm Alice Bandukravi. First tonight, how our hospitals are coping with increasing pressures and the impact this is having on patients. We've been given access to the emergency department at Queen's Hospital in Romford. Staff say the situation they're working in is worse than at the height of the COVID pandemic. Patients wait in corridors. The doctor in charge says he wouldn't want his family to receive the level of care they are currently struggling to offer. Our health correspondent Karl Mercer has this special report.
It's a corridor, not a ward. But for the past couple of weeks, you'd have been hard pushed to tell the difference.
When is your date of birth?
This is the emergency department at Queen's Hospital in Romford, where the new normal is anything but normal. Care routinely delivered like this, some staff redesignated as corridor nurses.
All right, mind out the way because there's a bed coming, okay?
I think the first thing out of our mouths most of the time is just sorry, that we understand how frustrating it is, especially to the family members as well that are sitting next to them in the corridor. It's really not nice, and some of them have been here over 24 hours. If we was in their shoes, then we'd be really upset as well.
Put your best smile on.
And how frustrating is that for you as a nurse who's come in to deliver care?
Extremely. We don't train to give care in corridors. You know, it's not nice. We like to look after them as if they're our family, and we can't do that if we're doing it in a corridor.
In the corridor?
Yeah.
Well, I don't know. It's not very nice, is it, for people? But there you are. If they ain't a real book, they do.
Today, when we filmed, there were around 20 patients being treated in the corridors. More were arriving. How does it feel when you look behind you?
It's quite challenging arriving here every day and seeing patients outside my office. It's very demoralizing. It's not what I expected to work in when I started out in emergency medicine. We try to do our best for our patients in the corridors, but I don't think it's right, to be honest. I think it's not what I would like to see for my own family, to see them in a corridor and be treated and people walking past. We try to make it as private and as dignified as possible, but it's still not what it's supposed to be.
In the Major's ward here, things are full too. Patients here waiting to be admitted to a main hospital ward.
It's going to be on the telly then.
Yeah. People like Wendy and David and their son Ben, who've been waiting 8 hours.
We've moved from the corridor, so we're now here. We've just got here. So then we need the doctor to come and decide what's happening from here.
It's been a bit hectic, but like I was going to say, under the circumstances, we ain't got no complaints at all. Yeah, it is tough all round, but yeah, I can't praise them enough, to be honest with you.
Difficult times, really difficult. Just the long waits in the corridor, and it's a heavy load. It's a heavy load. Difficult with staffing. It's just sad. It's really sad to see us in this crisis that we're in.
This hospital, like every other, is facing issues with being able to discharge patients who are medically fit to leave. Here, that's about 120 people a day, 120 beds that can't be used for new arrivals.
So we've got a really big focus at the minute on understanding what's causing those delays. Some of that's down to us, getting our processes quicker. Everyone's got a story about being ready to go home and having to wait all day until they get their drugs. We need to fix that stuff ourselves. But we also need to understand, why can't home care agencies get the staff to provide those packages of care? What can we do to fill more of the empty care home beds that can't be staffed in the area around the hospital? And what can we do working with primary care so that some people don't even need to come here in the first place?
This is not what staff were hoping for after 2 years of COVID. The pressures can seem relentless.
I feel at a loss about what to do and how to make it better. Part of my role is trying to make things better for staff and for patients, and I can't see anything that I can do. Obviously, it's very, very difficult to see patients and their relatives in this situation, and trying to provide care in those corridors and just waiting in the emergency department for such a long time. But also for the staff who I see coming in and working so hard and so tirelessly in just what are crazy situations. And I'm just not quite sure how I can do anything to make it better for them.
They will rely, as always, on teamwork, but the strain is taking its toll. Karl Mercer, BBC London.